Hi there, and welcome to this presentation of how Ashford Borough Council used mapping during the coronavirus pandemic. I'm James Sloan, Digital Content Officer. We're also going to hear from Ben Robinson, Customer Service and Digital Project Manager, and Jess Brown, Policy and Research Assistant. Now we've sort of split this up into three areas. Firstly, we're going to have a look at mapping for volunteer groups. Then we're going to have a look at mapping essential services for the community. And finally, we'll look at mapping for our internal use and how we could then analyse that data to highlight any areas of concern. So, looking at the volunteer groups, firstly, we met with Ashford Volunteer Centre shortly before we entered lockdown, basically to see how both organisations could support one another. A combination of the Volunteer Centre's understanding of the sector and our digital reach was a benefit to both parties. And in order to cover the largest geographical borough in the county, we divided the borough up into its 39 wards. 2 online forms were set up. One was for groups of volunteers, and the other was for individuals who wanted to volunteer. We asked each group or individual the work that they could carry out. For example, dog walking, collecting prescriptions, collecting food, and also which ward or wards they would be willing to help in. Based on that information, we were then able to map groups by applying them to the wards that they were active in. For the individual volunteers that completed those forms, they were then contacted by the volunteer centre themselves. And they were better placed to then recommend a volunteering group local to them that the volunteer centre was already aware of. Everything was very fast moving at the height of the pandemic, so we didn't have much time to waste in getting this ready and online. As such, we tried to repurpose maps that we already had on the website, namely ones that showed ward boundaries already. And the fact that we had these drove our thinking that we already had a method for dividing the borough up in front of us, and that was to use the ward boundaries. We needed to gather information from groups, so we created those forms to capture that data. We asked volunteer groups to indicate which wards they're active in, and then we plotted that on the map. We also used our social media platforms to spread the message and to collect more form entries. The webpage went live on the 27th of March 2020, and it had 4,175 unique page views within the first 4 weeks. In terms of the forms that we received back, we had 100 different groups complete the form to let us know where they were operating and how they were helping people. These were then published on the website, and we had 398 individuals complete the other volunteering form, saying that they wanted to help and volunteer. Their details were then shared with Ashford Volunteer Centre, who then helped them to operate with an existing volunteer group in their area. And from a resident's point of view, they were able to find help that was localised to them. In terms of what we're doing with the volunteer groups now, we've recently reviewed them and removed any groups that are no longer active. But for those that are still running, we've left those on the website for now. What we're looking at is potentially adding a postcode lookup. We've got one that goes away to the Democracy Club website, but maybe if we had that embedded on the map itself, that would make it more user-friendly, because not everyone knows which ward they live in. I'm now going to pass over to Ben, who's going to talk about some of the other key services that we were able to promote via the website.
When the pandemic started, the main drive from the government was that people who were shielding might need support in getting essential food supplies. On our website, we signposted to key supermarket delivery information and contact details for residents to access. However, as lockdown began, it became more increasingly difficult to find a delivery slot. Lots of local businesses branched into online sales and deliveries, and we wanted to help residents and promote local businesses, and that's why we set up an online food delivery business search. Firstly, we needed to collect the information that we would then promote through the website. An online form was set up for businesses to complete, and that informed us of the product or products that they sold and where in the borough they were delivered to, and also any links to any websites or social media channels that they had. We then pushed this form on social media, and we was able to reuse the mapping used for the volunteer groups, and we're able to inform residents of local businesses that would deliver products to their area. We worked closely with our environmental health team, who gave the green light on every business before they were listed on the site. This was to prevent promotion of businesses that weren't compliant with food hygiene standards. Also, our IT development team worked on a filter function so that users could find either the type of supply they needed and also what business would deliver to them. 46 businesses completed our online form and were subsequently listed on our website. Residents visiting our website could find local help, but the map was also heavily used by our customer service advisors when speaking to residents over the phone. We then received some great feedback from our residents.
In addition to mapping our volunteer groups on the website, we also mapped our volunteer groups against our vulnerable residents. This is so we could see areas where there was a high need for support during lockdown but low provision, as well as the groups would be able to provide support to areas in need in order to more effectively get help to vulnerable people. Our staff made regular contact with existing groups to ask them questions about their funding, the level of donations and number of volunteers, and ask them to assess their current situation to find out if they could continue to offer their services should local needs increase. The feedback from these groups was recorded and categorised in order to assess how at risk they were of being overwhelmed, disappearing suddenly once lockdown ended, or running out of donations, volunteers or funding. The end result was a ragged risk assessment for each of the community groups, which we then overlaid onto a map of the borough using Excel's 3D maps. Each point represents a community or volunteer group with the colour of the data point indicating the risk level. To better understand how many residents were vulnerable due to COVID, we used Acorn geodemographic segmentation to estimate the number of vulnerable people in each ward of the borough. Acorn segments the population into different categories and types based on either postcodes or address data. In this instance, we used household types that enabled us to see which households were vulnerable. Acorn combines many data sets from different sources in order to create these household types. They provided us with a large data set comparing different factors you might find in a typical UK household to their prevalence in each household type. We selected a few of these factors as vulnerability indicators and investigated in which household types these indicators were most prevalent. By doing this, Acorn allows us to better understand who is vulnerable in a non-medical regard, such as people who are isolated from others without outside support, people who would be at risk of financial hardship, and people would be finding it difficult to do day-to-day activities like food shopping. Once we had established which household types were most likely to contain vulnerable residents, we matched these types to addresses in the local land and property gazetteer. This gave us an estimation of the total vulnerable households in the borough. We then matched these addresses to their respective borough wards to establish which wards had the highest number of vulnerable households. The data gleaned from Acorn was used to form the base layer of the map, with the risk-assessed community groups overlaid. The end result is we could easily see where there were gaps in provision, as well as potential upcoming issues with provision. We could direct residents to the groups able to support their needs more effectively, and we are in the process of adapting this mapping analysis for use in other areas as we are now entering the recovery phase of the pandemic.